morning, and committee members and listening audience out there in Cyberland. Thank you for giving me the honor of presenting House Memorial 36 this morning. It's asking the Legislative Health and Human Services Committee to study hospital charges for uninsured patients. I believe that the legislature should hear how public funds are used by hospitals and what uninsured patients are charged for their care. Before I go into the full presentation of this memorial, I want to share just a little personal testimonial. I have lived for 38 years with HIV. I'm the only member of the Senate and the House who has that ailment. For most of my adult life, up until the last 2 years, I have been uninsured. It's been spotty. I've worked in nonprofit, struggling grassroots providers that are important but didn't have the capacity. And over the course of my life, I fell into, I lived in New York City, Los Angeles, and I was hospitalized for various reasons. And it was extremely stressful to see that I didn't have insurance and that I was put into debt collection. The pressure, the stress of that, let alone, healing from whatever ailment I had at the time. I was deemed middle class. I don't have children. I'm not extremely poor. But it struck me personally when I was asked to look at possibly presenting this particular House memorial. I said, absolutely yes. Because as a governing body, the best thing we can do is to convene, to deliberate, to sift through, and really consider fully the laws that exist, those that perhaps should, particularly when they pertain to healthcare. So it's a deep honor to serve on this committee. I'd like to just read the opening passage before we go to our guests. The bill requests that the Legislative Health and Human Services Committee holds a hearing on hospital charges for New Mexico's uninsured patients and for the Human Services Department, HSD, to report on New Mexico hospitals' use of public funds and provisions for financial assistance for those uninsured. Last year, I was part of the body, and we passed in 2021 the Patient Debt Protection Act. It's a great step. I'm not sure how many of those most vulnerable across our state understand the implications and the benefit of that law just yet. In closing, I represent a very rural district, Colfax County, all of Mora, a chunk of San Miguel, and a large swath of Rio Arriba County. I know personally that many of my constituents fall into the category of severe poverty. In looking at some of the research, something that really popped up for me, apparently there was a poll done of New Mexicans, and it stated that 59% of New Mexicans needed tests, treatments, appointments, and prescriptions, or had problems getting care simply because of the cost. Last summer, I was part of the first interim process, and I appreciated so much that experience because it was relaxed. We had time to delve deep, to unpack, to consider fully. It is our duty as a legislative body to bring the best possible product forward. With that, Madam Chair and committee members, I present my two expert witnesses who I see have been waiting patiently. Mr. Nicholas Cordova, who works as an advocate diligently at the New Mexico Center for Law and Poverty, and Dr. Jesse Barnes. I defer back to you, Madam Chair.
Your experts can go ahead and make a statement if they want, or go ahead, however you want to do it.
Okay, let's go with Nicholas Cordova first.
Thank you, Madam Chair, members of the committee. First, I want to just give you a heads up that my internet's a little spotty today, so if I come in and out, that's why. Like Representative Montoya said, my name is Nicholas Cordova. I'm an attorney at the New Mexico Center on Law and Poverty, an organization dedicated to social and economic justice through legal representation and policy advocacy. We at the center are members of the New Mexico Together for Healthcare campaign, which is a community-led movement seeking quality, affordable healthcare for all New Mexicans. Every New Mexican should be able to access the healthcare they need without being afraid of devastating medical debt. Unfortunately, that is not the reality for many New Mexicans. So let me tell a story about an individual we worked with at the center. His name's Michael. Michael works at an assisted living facility here in Albuquerque. He lives here in Albuquerque, but he doesn't have health insurance. In fact, he couldn't and can't get health insurance because his job doesn't offer it, and he isn't eligible for BWellM. Over a year ago, he was rushed to a hospital after being bitten by a brown recluse spider at home. When he was discharged several days later, the hospital sent him a bill for over $60,000. So without insurance, he was paying entirely out of pocket. And the hospital self-pay policy brought his bill to still over $18,000. So when he came to us for assistance and we looked at his bill, we used the hospital's price transparency tool to compare his charges to what insurance companies would pay for those same services. And we noticed that even with the discount, he was charged substantially more than what insurance companies would pay. Just as an example, for a blood test alone, he was billed $110. That is up to 10 times what plans on BWellM would pay for that same service, 10 times. And because he couldn't afford his bill, he was sent to collections later on. Unfortunately, there are tens of thousands of New Mexicans who could be placed in similar situations. The most recent projection says that over 200,000 New Mexicans don't have health insurance. Nearly 1 in 4 New Mexicans have medical debt in collections, and thousands are being sued by hospitals for bills they can never afford. This past December alone, 2 hospitals in New Mexico sued almost 100 patients in 1 month. And we know that people facing medical debt are 3 times more likely to postpone needed medical care. Even though public funds are made available to help with the costs of providing care to uninsured and low-income New Mexicans, we know that a lot of these patients who should be getting a lower financial assistance rate are still falling through the cracks. Data from the IRS in 2019 shows that for New Mexico's nonprofit hospitals, an average of over 1/3 of their bad debt came from low-income patients who are not getting financial assistance for which they qualify. Some hospitals reported that these low-income patients accounted for up to 2/3 of their bad debt accounts. So what this shows is that a lot of uninsured patients and low-income patients are likely getting hit with hospital bills that should either be reduced or eliminated altogether. And there are state and federal sources of funding to cover the costs of care for uninsured patients. The state safety net care pool, county indigent funds, federal DSH payments. And this doesn't even account for the tax benefits realized by all of our nonprofit hospitals here. And like Representative Montoya said earlier, this legislature fortunately passed the Patients' Debt Collection Protection Act, which requires hospitals to annually report to HSD how they're using these state and local funds. And so this memorial serves as a critical first step in providing transparency on how hospitals are spending our public money for uninsured patients. And it's well past time we had a conversation about this issue and whether we as a state are doing enough to provide affordable care to our low-income patients. Thank you.
Excellent. Thank you so much, Nicholas. I'd like to ask Dr. Jesse Barnes, who is a frontline practitioner in the field, to speak on this. Thank you. Dr. Barnes, go ahead.
Thank you, Madam Chair, Representative Montoya, and members of the committee. I'm a practicing family physician. I've spent the last 15 years working in a variety of settings around New Mexico. I currently work at a community health center in the South Valley. And I've also started a couple of patient-focused advocacy groups, one of which worked exclusively around issues of medical debt. So this is an issue that's extremely important to me and to, I think, many, if not all, other primary care physicians around the state. Representative Montoya shared a really powerful story, as did Nicholas. To me, the first thing that comes to mind when I think about this issue is a patient I saw very early on in my career when I was doing locums, sort of a substitute doctor job in Cuba, New Mexico, for a couple of days. An elderly gentleman who had fallen and suffered a really bad laceration sort of through the outside of his nose that went all the way through to the inside of the nose. And we spent this fairly long visit with me trying to explain all the potential risks and complications and why it was really important for him to go into Albuquerque and have a specialist do a high-level repair of this issue to prevent infections and other problems down the road. And he, who was unfortunately uninsured, spent the entire visit answering those medical concerns with his financial concerns. How much was it going to cost? What financial aid policies would be available? And I simply couldn't answer those questions. It's too complex a system to understand for every patient how much particular care is going to cost. He ended up asking me to do the best I could. I spent half an hour on the phone with a doctor in Albuquerque, trying my hardest to do a procedure, which was really sort of something that shouldn't have been done in the field there, but at a specialized center in New Mexico. And feel to this day that patient did not receive the highest level of care that was available because he was uninsured and did not have access to the means to get that care. And unfortunately, I think that sort of set the tone for a career in primary care, where on a daily basis across the state, we're forced to consider with our patients the cost, the billing policies, the financial aid policies, rather than the medical issues at hand. I know that the legislature did some amazing work last year, but this is still, I think, an issue that's very complex. Just to point out a couple of the issues that we run into fairly frequently. Even when we know the charges for particular services, when patients are sick, they don't usually know what they have. That's sort of the root of the problem. And so if you don't know what you have, you don't know what the charges associated with your care are going to be. So there's really most of the time no accurate way to anticipate exactly how much services are going to cost ahead of time. And secondly, I think across the state and at the various hospitals, which do amazing work taking care of New Mexicans, the variety of different financial aid policies and how those policies are publicized and advertised to patients, how patients apply for and get access to those policies, who qualifies for those policies based on their income level, based on their residency. These issues are incredibly complex. They're fairly opaque most of the time. And most of our patients, many of our providers simply don't have the knowledge and the expertise to navigate all those complexities and give patients an accurate sense of how much services are going to cost, what programs are available, and sort of relieve that worry that patients often have about ending up in crippling medical debt. And so in spite of the work that was done last year, I think there's still a lot to be studied on this issue. We need to know what the policies are across the state. As Nicholas said, we need to know how public dollars are being spent on programs for uninsured patients so that we can find out where the loopholes, where the gaps are, and so that we can inform the public of New Mexico what is available, and people can stop having to neglect themselves in their care out of fear of medical debt. So I'm very grateful to Representative Montoya for bringing this memorial and for all of you for hearing it today. And I will stand along with Nicholas for any questions that the committee has.
Hi, this is Bill Wagner. I'm a clinical social worker and I'm the founder and director of Centro Savila. We're an outpatient behavioral health program in Albuquerque, and we serve mostly uninsured clients, many of whom are Spanish speaking. I just wanted to tell a story quickly about a incident that I experienced, which was I showed up at our office in the South Valley one day, and there was a woman in her car grabbing her chest, an older woman. And I saw her and I ran inside and I said, "Does anyone know who's in the car?" And one of our employees said, "That's my mom." I said, "She looks like she needs help." And we took her, we wanted to take her to the hospital and she was afraid to go. My point being is that she had an experience in the past where she had to pay she was charged up front when it was medically necessary and it was an emergency, and she was afraid to go. There's a lack of trust in our public institutions. We need transparency, and I think when we can have more transparency about where these dollars are going and there's better access, we will have less racial health disparities. So I urge you to pass it. Thank you.
Good morning. This is Hương Nguyễn with New Mexico Asian Family Center. Can you hear me?
Yes, we can. Go ahead.
Okay, thank you. Hi, my name is Hương Nguyễn and I'm with New Mexico Asian Family Center. Dear Madam Chair and members of the committee, I'm here to support HM 36 because we are talking about more than 200,000 uninsured patients in New Mexico. We are also talking about the public funding that the hospital are using to cover for part of the charge. So I'm here to really urge you to vote yes for this memorial to start the first step in making sure transparency and potentially accountability for people that are really vulnerable. So again, thank you so much for your work and hope that you are stay safe and well. Thank you again.
Thank you, Madam Chair and members of the committee. I want to especially thank the sponsor for this memorial and glad to see that he is well and recovered well. As a cancer patient and today marking World Cancer Day, I know that many members of this committee have been impacted by cancer. What many of us face as cancer patients is really going through treatment, but having to also become experts in insurance, and especially for those that are uninsured, having to both navigate their cancer, their prognosis, while also navigating the hospital systems and finding coverage is also a challenge. So understanding the inequities, whether it's being charged different amounts compared to other chemotherapies is important. That's why I urge your passing of House Memorial 36 so that we can understand the inequities and the injustices that many of our cancer patients like myself face. Thank you.
Thank you. Thank you for all your advocacy through the years. Next, we have Leroy So.
Good morning, Madam Chair and committee members. My name is Leroy So. I am from Tulagai, a small community 8 miles north of Gallup, and one of the core leaders for Forward Together Action. We are in support of HM 36 100%. No one should be taken out of town to be treated when there is a hospital in our town. And language barrier is a big factor. With a diverse community, many don't have insurance and never get a chance to get an explanation for what they are being billed for. This bill will help the patients and doctors have better communication. Thank you.
Next, Barbara Weber.
Good morning, Madam Chair and members of the committee. Also want to thank the sponsor for bringing this very important bill forward. Health Action New Mexico, of which I'm the director, totally supports HM 36. We've supported similar bills in the past, and we think the time has come and it's never more important. In addition to everything everyone has said, I want to remind the committee that this year we expect at the end of the public health emergency federally, 85,000 people will drop off of Medicaid and will be without insurance unless we have a really bold plan to include them. We also have the children's credit expanded that went away January 1st. And so for 450,000 children, they lost that additional source of income. So we're very concerned that the number of the uninsured is really going to grow in the next year or two. So we strongly support the bill.
My name is Althea Yazi. I'm from Twin Lakes, New Mexico. I live on the Navajo Reservation. For the past 6 years, I've been fighting for affordable health care for New Mexico families. And this year, my symptoms from RA has been to Sjogren's syndrome. And now I have to travel to Albuquerque for medical assistance. I support HB 36, and let's keep our insured families insured. Our Navajo people over here are struggling and are afraid to even go to the hospital because of insurance reasons. Our survey showed that 100% of us natives are really scared to go to the hospital because some of them are even insured. The ones that are insured are being charged twice. So we need to keep our families healthier. Just remember, our lives aren't valued, they're valued. Thank you.
Next, we have Forward Together Action. Go ahead.
Hello, can you hear me?
Yes.
Okay, good. Yat not ani istan, Linda Thomas, Ado Besana, Besan, Daha Aniki, Ado Dide, Tatino, Fayojo, Specifications, Zenigi. Thank you, Madam Chair, and the rest of the committee, and especially, and then there, of course, the sponsor. I strongly support HM 36, and that is what I want. This is Verna Craig. I am one of the core leaders of McKinley County, and we need this. And I speak for everyone across the state. And as usual, I would like to say to everybody out there, what I say at the meetings is healthy state, happy state. And I believe that our leaders up in Santa Fe will do this for us because we fought too long for this. And it's time that we put it on the table and get this passed. Thank you very much. God bless.
Good morning, Madam Chair and Madam members of the committee. My name is Maria Gurciella. I live in Salem Park, and I'm with Strong Families and Forward Together. I strongly support the bill HM 36 because it's a needed, it's something that we need, and it's been too long that we're waiting for it to happen. Thank you.
All right, this is Dr. Connie Liu. I work as an OBGYN in McKinley County. I just wanted to provide some of my experiences. I know, so my patients in this community are primarily Navajo, and I will say that the issues that are brought up in this bill impact my patients. At our local private community hospital, 70% of patients served there are Native American in a county where 20% of community members are uninsured. It's very clear that patients have issues with navigating the system with price transparency. I know of a patient who delivered a baby at the local hospital and received an unexpected bill. This was a woman who had persistence, access to a computer, and time to navigate the system. And it took her several phone calls and several weeks before she could resolve her bill. I know that this is not going to be the case with many of my other patients who have difficulties navigating the system because they don't have regular access to the internet, live long distances away, and don't have regular phone service. This House Bill 36 will go a long way towards identifying those issues and reducing the barriers to care in our area. And so I speak it strongly in support of that. Thank you.
I will go to the committee. Representative Bunka.
Thank you, Madam Chair, and thank you, Representative Montoya, for bringing this forward. This is such an important thing for the state to do. And really, thank you for the beautiful testimony of the community members who are doing the work or who are the most impacted by what this will do. Hearing these stories is absolutely heartbreaking, but also lights a fire to do this and to do it now, because we know that data is so powerful and is so important for good policy making, good just general decision making, and gives us puts us in the right direction as we think about what the state needs so that we can do the best by our families. I wanted to share how this would have impacted my family. My dad, I remember when I was just starting college, he was climbing down from the roof after finishing up fixing the swamp cooler, and as he was stepping down the ladder, he fell off and he had probably like a foot-long gash down his shin that we could see the bone coming out. And I said, oh my gosh, we have to go to the hospital. And he said, no, we can't, because I don't have health insurance and I don't have money. And that to me was one of the most one of the most traumatizing events in my life, because I had to sit there and watch it and not be able to do anything. And he called my uncle over, and they helped to just seal it together with what we had at home. And he did his best to continue cleaning it for days on end. And I came to an understanding at that moment that this wasn't the first time that they had to do something like this. They knew exactly what to do, and they were supportive of each other to mend each other. And at that moment, I realized, yes, healthcare is absolutely a human right, but it's not something that's recognized by our institutions, by who has and who doesn't have access. So with all the powerful stories here today, I just want to thank you all for reminding us of why we need to be doing this work. And again, thank you so much, Rep. Montoya, for ensuring this gets in front of us today. Thank you.